We all know how important staying healthy is. Check out our next story.
Healthcare can be complicated, but with the right help, it doesn't have to be. Health management companies play a crucial role in supporting healthcare providers and patients in navigating the challenges of the healthcare industry. Let's visit with Dr. Perowit of Arkos Health to learn more.
Healthcare, when I look at it overall nationally, the system is broken. The way it's designed for providers and hospital groups, the incentives are malaligned. And so when we look at who's actually being adversely impacted, it's our patients. Part of that is wasteful spending, unnecessary services being provided, and a lot of that has to do with the patient's education. When we talk about benefits of a seamless healthcare system, everybody should have information that's a part of the patient's care team or health systems in that community that may serve that patient so they can better take care of the patients.
Patient-centered services and personalized programs contribute to the efficient and effective delivery of healthcare services.
Arkos Health comes in and fills those gaps in the system for the patients. We'll coordinate services, we'll coordinate the care, and we'll make sure that we're there to give them a holding hand when the patients need it. If a patient can't see their primary care doctor that day, we'll send a nurse practitioner into the home to see them. If they need a refill on medication, we can call that in, or we can provide services via telehealth as well. For the payer, it works out well because if they're getting, I will say, concierge level services, basically that's what we provide to the patient, then they're not seeking care in inappropriate settings, which saves the health plan money and improving the overall patient experience with our services added in there. So we have a transitional care services program, so when a patient does get discharged from a skilled nursing facility or a hospital, we will outreach to the patient and make sure there are no gaps upon discharge. So if they need oxygen at home or they need IV antibiotics or DME, we're making sure that that's delivered to the home for the patient. We have an intense care management program, which really is a program for patients that have acute needs. If they need lab tests done, imaging tests done, we'll coordinate all that for them. We also look at the social determinants of health. So if they don't have food on the table, that's preventing them from getting health care, then we'll arrange for Meals on Wheels, or at times we've gone out and we've stocked their refrigerators. We'll coordinate transportation. So we provide a lot of services around intense care management. We also have what we call a palliative care program. It is a symptom management program. These patients are all hospice appropriate, but we offer a palliative care program where they're not forced to go on to hospice, but they can still get high-level care in the home with our nurse practitioners, manage their symptoms, refill their pain medications or other medications they need. Our goal is to make sure that they get care in the appropriate setting.
And all of this is done at no cost to the patient.
Because health insurance companies don't have the capacity all the time to serve large populations, they'll come and hire us to help their patients. They know that by providing good outpatient care, good member experience, that they will not only drive the quality of care that's being delivered through their system, but they're also going to drive their cost down. For a lot of these practices, what has happened is they've become a production line. They can see patients quickly, but we bring the added benefit of additional education, additional support that some primary care providers just don't have the ability or the capacity to provide to their patients. When we provide these services, it doesn't cost the provider anything, it doesn't cost the patient anything, but our entire goal is to improve their health, make sure that we can empower them as well and educate them as well about their health. A lot of our efforts around communicating with our providers is if they are willing to give us access and integrate with their EMRs, we will do that. We also have a ribbon technology, so where we don't integrate with the health plan, we can still provide data and tools on their EMR. When a patient pops up, there will be reminders to remind the provider on certain healthcare things that need to be done for the patient. We have an entire provider relations team. So when the provider has an issue with the insurance company, whether it's a claims issue or a prior auth issue, their staff doesn't have to spend the time on the phone trying to get someone at the health plan to talk to about their issues. We take care of that for them. We have a system called Arcos 360. So we're looking all around every aspect for data sources and data feeds. So we can use all that information to integrate into our system so we have better insight into patients. But part of the Arkos 360 is our ability to evaluate which patients are going to get into trouble from an analytical standpoint, which patients need telemedicine services, so it supports our telemedicine platform. We have a very robust health information exchange system, so we get a lot of information. So when a patient's in the emergency room, we know that the patient's there. When the patient gets discharged from the hospital, we know that the patient's getting discharged. So we incorporate all that data into our own engine. It gives us a very good look at what's happening with the patient in real time. And the other aspect that we want to use technology for and that we're embarking on is the patient engagement. In a lot of these services, patients have a lot of competing priorities when it comes to healthcare. The last thing they're thinking about is healthcare, and we have to make sure that they understand that healthcare should be their top priority. When you kind of look at patient experience, we're trying to gamify that patient experience. And so if they're actually playing a game or something similar to a game that gets them interested in their healthcare, I think we're going to see more and more engagement being driven and more people taking ownership of their own healthcare. So that is the next area of technology that we are embarking on, is how do we gamify the experience for patients.
Helping people to achieve total wellness through quality health services is a top priority.
When we talk about our approach, it is a population health approach. How do we deploy strategies that will actually increase the health of the entire population? We have to have population health strategies, not only as a country, regionally, but health plan level wise as well, to improve the health of the entire population that we're serving. What I'd like to see in the future is that more of these strategies are deployed around the country. There are plenty of markets in the United States where a lot of these services are not available. The plans just don't have health plan partners. And that's what Arcos has been focused on. We have to come together and improve every state's ability to have a health information exchange where the information can reside and be stored and be accessible to anyone that's taking care of that patient, so we can provide timely and accurate care for the patient based on accurate data. So that is what I would hope for the future for our healthcare system.
To learn more about Arkos Health, visit the website at arkoshealth.com or see this segment again on thebalancingact.com.